Direct from Foxborough, Massachusetts, the gem of Norfolk County, and taped at the studios of Foxborough Cable Access. It's Foxborough Central. And here's your host, Bob Hickey.
And welcome to another fantastic episode of Foxborough Central. I am Bob Hickey, your host, and I want to thank you for taking the time to join with me and my guest as we talk about the people, events, and organizations that make Foxborough truly the gem of Norfolk County. Now, today's program is not going to be an extraordinarily upbeat one, although it is a program of hope, in my opinion. I'm talking with my new friend, Jim Derrick, with the Safe Coalition. Jim, thank you for joining us on Foxborough Central.
Thanks for having us, Bob. Much appreciated.
Well, it's great to have you, and you've been a guest before, and we've had an event, but I'd really like to dig a little bit deeper and more, and we have a little more time now to just talk about the Safe Coalition,
Sure.
What it is, how it came to be, and what the mission is. So let's start at the beginning, what is the Safe Coalition?
Thank you. Thanks for asking. Safe Coalition, the acronym SAFE, stands for Support for Addicts and Families Through Empowerment. And we were founded back in 2015 in response to an escalating amount of fatal opioid overdoses in the town of Franklin.
Okay.
My colleague and friend Jennifer Knight was a citizen in Franklin. She's since moved, but still is our vice chair of our coalition. She had reached out to State Representative Jeffrey Roy and said, look, I'm a recent Franklin High graduate. I'm tired of coming back for funerals. Is there something we can do? And Jeff Roy got together with Jennifer Knight and a town councilor in Franklin and launched this coalition, which now represents 8 towns.
Interesting. I've had the opportunity to meet Jennifer. Very dynamic young lady, and I'm glad to hear that the organization, which began in a small scale, is growing. So we're only 3 years into the project, and now there's 8 communities. Right. How are these 8 communities joined? Is this more of a, when you say Safe Coalition, right, what exactly is the coalition?
Right, great question. So a coalition by nature has stakeholders. And in our case, since we are an alcohol and drug and substance use disorder coalition, our stakeholders are quite obviously have to do with that subject mm-hmm. matter. So we have police, fire, citizens like myself, people in long-term recovery, local and state officials, government officials, as well as people in the recovery community, I might have mentioned that before, and treatment facilities. We bring all those people together. The way that the towns have been joined together is really through our corporate charter, which has been modified as more and more communities wanted to come on board. It is our coalition, mm-hmm. Norfolk County's coalition. We represent towns all the way from Mansfield, Foxborough, including Foxborough, all the way up to Medway and towns in between, and about 250,000 residents. The idea behind a coalition is that there is strength in numbers. There is a lot to be gained by bringing people together under one umbrella, and so we found it's a very effective model.
Okay, interesting. So when we say coalition, what is a town joins and it gets involved, but what is it that we're trying to get the towns to do? What do we want a town to do?
Great question.
Or what does the town want
right.
you to do?
Right.
I guess is a better question.
So a town plugs in any way, shape, or form that they see fit. And all of these towns and these wonderful volunteers and board members that we have from these different areas, they have different needs and bring different ideas to the table. So we're constantly changing. But broadly speaking, we have three parts of our mission statement. The first mission is to reduce the barrier to treatment. Treatment is a very difficult thing to access, even today in 2018. Really? Very, very
There's
difficult.
Been so much attention given to opioids right. and Narcan is the magic cure now, right?
Right. Well, it's actually not a magic cure.
It's not.
It's providing a lot of people a second chance. And there's some real pitfalls in thinking that Narcan's a magic cure. We've done a very good job in promoting it. I say we, meaning state and treatment providers and emergency rooms. But your point is well taken. We have a lot fewer deaths today as a result of Narcan. But that's not treatment.
But that's not the issue.
Right. So treatment...
Narcan is simply a stopgap measure,
right.
but the real issue is
is getting a bed in a treatment facility. So there's really 2 problems today, and these are the barriers to treatment that are set awfully high, particularly when you think about the fact that this is our nation's #1 health epidemic. Just to frame the issue a little bit more, for opioids alone, we will lose in excess of 2,000 people in 2018 to fatal overdoses. That's in 2018. In 2010, we lost 600 people. That's a 300% increase in 8 short years.
And that's even with the intervention of Narcan.
Exactly. Well put. Exactly, Bob. So what we're trying to do is to bring attention to this and to get treatment more accessible to people. So what does that mean? First of all, we have enormous financial barriers. Insurance carriers are not compelled, even though there's a Parity Act on the books, insurance carriers are not compelled to treat addiction, alcoholism, as any other illness.
Okay.
So they are able to carve this out, and people are left to fend for themselves, number one.
Okay.
Number two is just a raw access to the system. So if you are unable to pay for a fancy rehab like you might see in California or in Florida,
sure.
Then you're left with the Department of Public Health Services here in the state, which can be offered either for free or you can access it through Mass Health. That's wonderful news, except we just don't have enough beds for people.
When we say we don't have enough beds, what is the volume? I mean, what are we? Because here's the thing: I look at this and you say to yourself, somebody should do something, and clearly the SAFE Coalition is working to create the mechanisms to gain that treatment, have access to the treatment. But what is the state doing? What are the hospitals doing? Is this a private issue? Is this a partnership? I mean, who would generate these treatment beds in the first place?
It's a great question, and it's one that's being asked every day.
Because this is all relatively new.
It is the
although
uptick is
although it's
relatively
such a huge issue, you hear about it, you read about it, you are touched by it. But what do you do really?
Right, it's a great question. So people may remember Marty Walsh in early spring announced at a speech that he gave.
Mayor of Boston.
That's right. I'm sorry, Mayor Marty Walsh, who's also a man living in long-term recovery.
Yes.
He announced that he was going to try to reopen Long Island in Boston Harbor,
Which
and
was closed because of the bridge.
Exactly. That may or may not be feasible, but it's great thinking. This is now an opinion of mine. I believe it's going to be a combination of a public and private partnership. I have a meeting tomorrow with a group of manufacturers and businesses, high-tech businesses in the Commonwealth that want to provide a private source of solution to this. So it's a great question. We don't have the magic bullet yet. We're still looking. But the coalition exists, and I should give out our telephone number.
Well, I was just going to do that because I was going to say this leads us into what the SAFE Coalition does and what the mission is. I'm speaking, of course, with Jim Derrick. He is the president of the board of directors. Their telephone number is 508-596-4885. You can also reach out to Jim at jderrick, JDERICK, at safecoalitionma.org. They also have a website. It's www.safecoalitionma.org. A lot of great information on there, as well as a schedule of upcoming seminars and other ways to gain access to the system, if you will. But that's what we're going to talk about now. You're leading the charge, if you will, of creating this partnership, or at least identifying some opportunities for private support. How would that work, though? I mean, what's the benefit?
Yeah, I should kind of backpedal a little bit. It was one of our stakeholders that brought this to my attention and asked me to take a seat on the advisory board. Businesses have a vested interest in this.
Why?
60% of all health insurance and health-related information are communicated through employer benefits programs to employees, which means on any given day, if you're 60% of your information is going out to employees, businesses have taken it upon themselves to become conscientious about their employees' health. If you have an employee that comes in with an addiction problem, obviously your productivity goes down.
But there's so many other issues that go along with that.
Pardon me?
Absenteeism.
Yep. Exactly.
Things that happen where you then end up with having crime and failed drug tests and violation of policies. But the worst part of it is the toll that happens on that person, because they're now destroying their own lives through the addiction.
Right.
And so you're right. It's
the amount of productivity lost is
understanding
just
understanding the financial ramifications is what I imagine would drive an employer to say, hey, we should do something.
And on that end, and then let's just face it that this is our nation's #1 health epidemic. It's good for employers to be attached to the solution to this. It's a win-win situation.
So you had mentioned insurance companies are not quite embracing this yet.
Right.
Where do you see this? Where do you see the SAFE Coalition advocating? Or I guess that's the wrong way of saying it. The better way of saying it is, when do you think the insurance companies will get on board or understand that it's a health problem that's raising their rates to the point where they should intervene proactively?
Only if and when they are compelled to by law. That's
the way
the
it
hard
works.
fact. That's the way it worked with mental health parity back a decade ago or so, when mental health they were forced to cover that as
Sure.
as any other illness, and that's the way it's going to work with this. Patrick Kennedy, if you go online and look up the Kennedy Forum, he's been instrumental in trying to get insurance carriers to cover this properly.
So then, where do we stand here in Massachusetts as far as that being an issue that's going forward, or is it still in its early stages?
We're stuck. Yeah, we're really stuck. I don't see much movement. Anecdotally, I hear certain carriers are liberalizing their coverages, which they certainly can do, but it's just inadequate right now. And there's a myriad of reasons for that, mostly financial.
Yeah. I suppose the problem's always that in a system such as ours, where health insurance is offered by the employer, you don't pick your employer. Well, some do, I imagine, but
Right.
for the most part, you don't pick your employer based upon an insurance policy covering opioids, because opioid addiction does not typically happen at the beginning. It's something you injure yourself, you go in for surgery.
That's right.
It's not something where it's you don't have the model. I mean, there's people who go in for wisdom teeth, and all
That's
of a sudden
exactly right.
it happens.
Yeah.
So tell us the tale of opioid awareness. I mean, opioid addiction. How does that happen?
Yeah. So opioid addiction, like many other addictions, and I want to emphasize, we are not an opioid coalition only. We certainly started in response to that startling statistic of those rise in fatalities, but we are a substance abuse coalition. So, but to your point, how do people get started on opioids? And you mentioned one way. It's sports injuries, wisdom teeth extractions. That's the first exposure to what really is synthetic heroin, which is OxyContin, Percocet. The state has done, Charlie Baker's been wonderful, and the legislature has really worked hard to limit the amount of these opioids that are being prescribed. There are laws on the books now that limit people to getting a 7-day or less supply. There's a prescription monitoring program in place which prevents, say, Jim Derrick from going pharmacy to pharmacy if he is an addict trying to get more pills. So there's been a lot of steps forward. Okay. But that's one entry point. Another entry point can be uninformed younger people partying, if you want to call it partying, and they get their first exposure at a pill party to these. And they're very, very powerful. Again, synthetic heroin.
Interesting.
Yeah.
I know that when I had my arm injury back in 2001, I was prescribed OxyContin, and I took one, and it made me I didn't like it, so I didn't. So I don't know if that is an experience that everybody shares the same. I'm sure drugs affect people differently.
They certainly do, depending upon.
I didn't like it at all, so I'm
If
probably...
I might just talk about the rest of our mission statement, because
Yes.
I apologize, I got sidetracked there. But so one of our missions, obviously, is to reduce the barriers of treatment. And we do that with our telephone line, which is 508-488-8105. And that's a support line that's monitored 12 hours a day. If you get voicemail, you will get a call back the next day, and we'll provide resources to you to get treatment. Second thing that we do is prevention. And so we work with school systems, we partner with police departments, we partner with the community on arriving at effective prevention programs. We had one at the Orpheum Theater here, thank you very much, Bob, with the Improbable Players.
It was well attended.
Right, very well attended. And so we've got tremendously creative people around the table bringing programming on the prevention end. And then the third area is destigmatization. And someone may say, well, why is that important? Why is it important whether or not we stigmatize somebody with an addiction? The fact of the matter is, and I can tell you from personal experience, I have a family member, which was my impetus for involvement in this coalition, who suffers from addiction. For years I sat at home and just didn't want anybody to know. And so stigma has the powerful impact of isolating people and stopping them from reaching out to get help. And today that can have fatal consequences.
And I suppose that is it's not a new issue. There's always been a stigma, whether it's with sexual abuse, whether it's with addiction, whether it's mental health. And the awareness issue helps to erase the stigma. The education helps erase the stigma, but also just talking about and exposing people to different people who wear green shirts, wear purple shirts. The more you see green shirts, purple shirts, the more accepting you are of green shirts and purple shirts.
Exactly.
And not being embarrassed and ashamed to talk about something is so hard, but but it's so necessary. And I'm glad we're here having the conversation now.
Right, and I will say that Foxborough has been a tremendous community to work in. I'm not a resident of Foxborough, I'm a resident of Franklin. We have members of our board that are residents of Foxborough, and it's just been a tremendous community to work with. You talk about opening themselves up, your police chief, your fire chief, your school department, and your citizens have really been responsive and are really looking to help provide solutions.
That's great to hear, and of course, Foxborough as a community, we're, as many communities, we've got strengths and we've got weaknesses, but it's great to hear that we're participating and trying to educate ourselves and trying to be part of the solution. Okay. So again, I'm talking with Jim Derrick, who is the president of the board of directors of the SAFE Coalition, and 8 community. Now it's 8 communities.
Yes, that's right.
8 communities are now part of the SAFE Coalition, dealing with addiction, opioid, alcohol, and substance abuse, and simply trying to educate, but also provide resources and to be part of the solution. You can reach out to them at www.safecoalitionma.org. That's their website. And you had mentioned an 800 number.
Right. It's actually a 508 number. It's 508-488 8105 is our support line.
So what does the support line do?
So the support line, different than a crisis or hotline.
Is this for the people who are addicted or for parents and family members?
Anyone that's seeking information.
Okay.
So we provide support to people, to family members that are looking for answers as to what they can do to help their loved ones. Mm-hmm. We provide support directly to those impacted by addiction and help them get treatment or beds. We help steer people in direction. We start a conversation with people. So there are 3 of us that man that line, and all of us have been trained in how to deal with this. We average about 350 calls a year.
Really?
Yeah.
It sounds like it's so necessary, and yet other communities are not doing this.
Well, they are. I mean, they are. It's a difficult thing to navigate. You can imagine, because you've got HIPAA and you've got different obstacles that are put in your path to man something like this. Again, this is not a crisis line. If you're in crisis or you have an emergency, please call 911. But this is designed, as I said before, to be supportive services. So it's been pretty effective for us. We're always looking for help, and that leads me to my next statement, which is volunteerism. We love looking for volunteers, absolutely. Yeah, if anyone is watching and wonders how they can become involved, please go to our website and look up our meeting schedule. We have a monthly community volunteers meeting, which is just that. It's a meeting where the board of directors and volunteers all come together to share ideas. We do follow an agenda, but we always save time at the end for new ideas and new volunteers to come on board.
Excellent. And of course, you can find that at www.safecoalitionma.org. And if you need a little more information, you can reach out to Jim directly at jderrick@safecoalitionma.org. That's it. So when the Safe Coalition had the event at the Marilyn Robbins Center, and thank you again for allowing us to host that. That was a wonderful night. It was empowering, but also humbling to see the challenges, but also the number of community resources available, because there were a number of information tables, a number of groups.
Right.
What is it that the Safe Coalition can really bring to the table? Say I call and I need resources. Do you have books? Do you have seminars? Do you have web? What is it that I could get?
I would say most importantly is we are a container, to use my Vice Chair's best word. We are a container for our stakeholders, like, I'll give you an example, Learn to Cope. If anybody is unfamiliar with Learn to Cope, if you go to the recent press conference that Maura Healey had, announcing the lawsuit against Purdue Pharma, which the Commonwealth of Massachusetts has now joined. I believe there's 40 or 39 other states that have joined this action against Purdue Pharma, who are the people that perpetrated really bringing these opioids to market. Joanne Peterson is the executive director. She founded this support group in her basement in 2004 when she just saw a desert out there and no information. There are now 27 chapters of Learn to Cope that meet around the Commonwealth. That's an example of a resource that we have in-house that we can direct people to for support. They can also expect to get access to treatment centers, to a clearinghouse of information, if you will. All things addiction and addiction related. And if we don't have it, we'll find it.
Okay, great. So clearly a resource, and you're able to help out. So if this is current state, always have to ask, what's the future? Where does the future hold for the Safe Coalition? Where do you see yourself being?
You know, I'm glad you asked. I never in a million years thought that we would be where we are today. I am so proud of the board of directors that we have and the people that we have around the table. You know, Bob, you won't, there's a, I'm sure you do volunteer work yourself. You know the feeling of that esprit de corps when you get people around the table and you watch an organization grow. We've gone from 6 or 7 board members and maybe 20 or so volunteers showing up on a nightly basis to our meetings, to 14 that are seated on our board now, including the clerk magistrate of the Rentham courts, other court officials, a physician, Dr. Wendy Cohen, who you know very well,
absolutely.
Mary Graham Louise, who's the
Healthcare,
incoming president of the Foxborough
Rotary.
Yes. We just have tremendous talent around the table from diverse sectors. And where I see the coalition going, I think we've been in a period of rapid growth. We have a couple of limiting factors. One is funding. So we've received our second $50,000 grant from the Commonwealth of Massachusetts, which goes directly into services locally here. The community's been very generous to us. The Lions just ran a very big fundraiser for us. We have no paid staff. We have no expenses other than providing services directly to the community. We don't pay rent. We have nominal, maybe $300 or $400 a month of expenses. Where I see us going in the future, I do see us firming up our foothold in each of the communities. I see us getting partnering more directly with schools. That would be my dream and hope, is that we could provide something more to the schools.
For education, for resources,
right.
Yes.
And I do see a partnership with police that is growing. Police are being asked now to be both social workers, physicians in dispensing Narcan. They're being asked, and as our teachers, they're being asked to do more and more with less and less. We'd like to partner with these agencies to help do things like provide overdose follow-up calls and maybe pay for a clinician to go out to homes to visit with families, to provide services to relieve the police of that end of things, or fire, or even the schools. So that's what my hopes are.
Well,
my hopes.
Sounds like a vision. Well, all the best with that. I'm going to give you the last word. We're almost out of time. I'm going to remind everybody, I'm speaking with Jim Derrick, who is the president of the board of directors of the SAFE Coalition based out of Franklin. They are an 8-community organization now that is really committed to being a support to those who either are addicted themselves or family members who are seeking support and assistance themselves with dealing with loved ones who have addiction. They are not just focused on opioids, although that is the one that's in the news and right in front of us right now, alcohol and other addictions. They are happy to support you with. They've been part of our community now for 3 years, and it's one of those things where you like to say you hope you don't need to have their services, but it's wonderful to know that they are here if you do. You can reach out to them, of course, at www.safecoalitionma.org. You can reach out to Jim directly at jderrick@safecoalitionma.org. And they also have a support line. It's 508-488-8105. If you yourself are in need of support, or if you are a family member of a loved one who needs support, maybe you just need to know where to go or at least get educated, they're a great resource. They've got books, reading material. They have also somebody to talk to who's been there and done that, because my understanding is that everybody who's part of the SAFE Coalition, at least your story is that you've gone through this yourself.
Right. And I think you mentioned a closing word. I think that would be my closing word. I just want people to know that they're not alone. This is a difficult, to say it's difficult is an understatement. I can tell you from personal experience, this has been one of the most difficult things I can ever imagine having faced. When you call us or when you come to a meeting, you will find out very quickly you are not alone. People are willing to talk with you and provide support to you and your family, either through resources or just an ear. And Bob, it's really, really important that the community knows that they no longer have to be isolated and shuttered away, that this is something that you can talk about. There's no shame in it. It is an illness. Just go to the National Institute of Health, defined as an illness, coded out as a mental health illness. So there's nothing to be ashamed of. And come out to one of our meetings. If you'd like to just help, if you're a concerned citizen, we have a lot of those. Come on out. There's plenty of opportunities to help. And by the way, there's opportunities to develop your own programming. If you have an idea, bring it on. We'd love to hear it. Fantastic. Jim Derrick, thank you so much.
Thank you, Bob. It is always it's so brave, and it's also so rewarding to see someone who takes these challenges and then builds it into something where you can now take what you've learned and reach out and help others. So a lot of credit to you and to Jennifer Knight and to everybody with the Safe Coalition. Thank you so much, everybody out there with Foxborough Central, for taking the time to join my guest as we learn about the current challenges of addiction and the Safe Coalition and all that they're doing to try to help us as individuals and as a community deal with those issues. They are a volunteer built on the backs of volunteers, as are we here at Foxborough Cable Access. I'd like to thank my volunteers, Betty Travers, Deb Storrs, Mike Stewart behind the cameras, Paul Beck behind the glass, and Tyler Scharfman, who is putting this all together for us. On behalf of all those here at Foxborough Cable Access, have a wonderful day, Foxborough. Take care.